How many grafts will I need? I've been losing hairs rapidly for the last 3 to 4 years. I don't know to what extent I will lose hairs. Need to know how many grafts will I need to get good density.
Thank you for your question. You submitted a single photo of the top of your head, and you're stating a question that you've been rapidly losing hair for the past 3 to 4 years. And you're asking how many grafts you will need, and you don't know exactly how much more hair you will lose. So certainly you're looking for guidance based on your idea of maybe improving your appearance with transplant. Well, I can certainly give you my perspective based on how I treat people like yourself in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been performing hair transplant for over 20 years, and I'm also the founder of Tricostem Hair Regeneration Centers, where we've developed a method for non-surgical treatment for men and women with thinning hair and pattern genetic hair loss. So I think that you can certainly get an informed opinion from what we would do if someone like yourself comes to our practice. So first of all, I think that one of the things that you have to understand when you ask a question like how many grafts you'll need is, first, how are you going to stop the progression of your hair loss? For men, really the only drug that is currently of any significant value to slow down the progression is a drug called finasteride, or trade name Propecia. Now, this drug works by blocking an enzyme called 5-alpha reductase that stops the conversion of testosterone to dihydrotestosterone, or DHT. The challenge here is that only 60% of men will actually respond to the finasteride in terms of slowing down their hair loss. But at the same time, at the level that you're at, certainly if you don't slow it down, then you will find yourself in a difficult position when it comes to getting transplant. In our practice, for someone like yourself, one of the first things we would recommend is an injection treatment we've developed called hair regeneration. What we have done is figured out a method of using platelet-rich plasma and a material called extracellular matrix to stop the progression of hair loss, to reactivate hair that is not growing, and to help thinning hairs become thicker. Now, what I didn't mention was that people are, since finasteride is a drug that is indicated only for male pattern hair loss, unfortunately there have been some reports and concerns about long-term sexual side effects, and which means that a lot of men are not taking finasteride, and this may be a concern for you once you do your research and learn about this as an option. With the single treatment, and in some cases 2 injections done separated by about a year to 18 months apart, we have been able to sustain improvement for our patients with 99% success for both men and women in the course of over 5 years. So we still treat everybody as individuals, and we treat patients who come from all over the world, and we do these injections every day. For someone like yourself, that would be my first line, is to try to help you stop the progression and to try to strengthen whatever hairs are salvageable. One thing that we have definitely learned over the many years of doing this treatment is that the earlier we catch somebody, the more hairs we have to work with, the better it is. Once a hair is gone, then it's too late to help that area of skin because there's no hair follicle that's salvageable. Now, when it comes to this topic of hair transplant, with someone with advanced hair loss as yours, you have to make a compromise. You're not going to be able to get coverage and density on the full scalp. For most men, when we talk about transplant, we talk about placing most of the grafts towards the front to develop a frontal hairline. Secondarily, you also have to understand that to achieve optimal density, you are going to need more than one transplant. It is very common for people to expect that they're going to get what they want with one, and although you will get improvement, from my experience, most people want a natural looking density. And in order to achieve that, although it can be achievable in certain areas of the scalp, you will probably want to do a second transplant. Now, what is the limitation? The limitation is the number of hairs in your donor area. So, again, for us in our practice where we were doing several transplants a week, we are doing so many more injection treatments to help people stop and reverse to their maximal potential with hair regeneration injection. So at this point, I think it's a good idea for you to learn more about stabilization to prevent progression. Losing so much hair in 3 to 4 years, the trend appears to be that you will lose a lot more in the next 1 to 2. So if you can stop that progression before you do a transplant, or at least slow it down, it might be a combination. Maybe you'll take finasteride and do a treatment like what I discussed with hair regeneration. But at least you will have more hair coverage, and you'll depend less on transplantation to try to maintain a desirable look. So I hope that was helpful. I wish you the best of luck. Thank you for your question.